You mentioned something earlier about men having breast cancer, and it's really, really important for people out here watching this to understand that breast cancer is not just females.
No, no. It attacks anybody, male, female. It doesn't matter if you develop the disease, if that tumor comes to you, if you have one of the genetic dispositions towards breast cancer, it can hit a man or a woman. It makes no difference. And the men are treated right now exactly the same as women, same chemotherapy, same surgery, same everything. We don't really know if that's good or not, because the men in the past have really not spoken up or spoken out about their disease because they were embarrassed to say, I'm a man and I have breast cancer. We all have breast tissue, whether you're a man or a woman, and a tumor can grow in that tissue, whether you're a man or a woman. So it's really important that men look for the signs that women look for also. Look for a lump, and it's easier to detect on men than it is on women. And usually a spouse or a partner can look and say, you know, you didn't have that before. What is that? You know, that's not moving around. And so then they need to go to the doctor. They get a mammogram also, and an ultrasound, and whatever else they need, and they do surgery. They can have a lumpectomy or they can have a mastectomy. So right now, they do have estrogen positive and estrogen negative breast cancer, just like women. However, hopefully the treatment that works for women works for men, but we don't know that for sure. And I think there's only a couple of trials out there now studying the difference between male and female breast cancer, because we know there is some difference, not a lot, but there is some difference there.
Yeah. Now, most of us bathe once a day.
Correct.
And that is a good opportunity when you're in the shower or taking a bath to do a self-exam, because we know that if you detect cancer early, your chances of survival greatly improve.
Improve, that's correct. However, if you're a woman and you're still having your period, you don't want to do it every time you go in. And that's because the breast changes throughout the month. And depending on if you're getting closer to your period, your breasts can be very sore. You might have more fibroids in your breast. You may have more cysts in your breast during that time. The fibroids come and go depending on what you eat and the time of month. So you want to do it when your hormones are at the very lowest in your body. If you no longer have a period, then we say pick a day of the month, and within a day or two, do your exam on those 1, 2, or 3 days, because your body will be basically the same every month when it's going through its cycles, whether you have a period or not. So for men, it's probably best to pick a day of the month and make sure you do it within a day or two each month of that time. But you still do use your 3 fingers, and you still do the soft, medium, and deep touch, so that you make sure that you feel everything.
So last question, you mentioned that October is Breast Cancer Awareness Month. And what are my friends at the Alamo Breast Cancer Foundation have planned for the month of October?
We're doing a lot of talks, teaching a self-exam, teaching women how to do their self-exam, the best time to do it, how to do it properly. And you just don't, go like that. There are certain ways you have to do it to make sure that you have early detection. Also, we're doing a lot of health fairs in the month of October. We're doing several outreach programs where we're providing free mammograms for women in our community, because unlike most of the countries in Europe, we don't have universal health care. And many of the people in my area of Texas have either no health insurance, or they have a very high deductible insurance because they can't afford anything else. They're the working poor. So we provide free mammograms for those women, whether it's a regular screening mammogram. If they need a diagnostic mammogram, we'll pay for that up to and through a biopsy.
Okay, well, Sandi, thanks for stopping by. I really admire all the work that you do for patients, caregivers, and their families. And I look forward to seeing you in a few months at SABCS.
Yes, you will.
Okay.
And it's not just me, it's a lot of people out there doing the same thing.
Absolutely. Well, thank you very much.
Thanks, Dave.